Supine position. In the supine position, the body lies facing upward, placing gravity evenly along the posterior skeletal surface. This orientation keeps the spine close to its neutral anatomical curvature, reducing asymmetric joint loading and minimizing the need for stabilizing muscle activity during sleep. As a result, neuromuscular demand decreases, allowing sustained parasympathetic nervous system dominance that supports systemic recovery. Blood flow remains bilaterally balanced because major vessels are not laterally compressed. This promotes uniform tissue perfusion and stable cardiovascular dynamics throughout the night. Relaxation of soft tissues in the neck can influence upper airway diameter, making breathing stability dependent on head and neck positioning rather than overall body orientation. Prone position. The biggest advantage is the prevention of airway collapse. When you lie on your back, gravity pulls your tongue and throat tissues downward, often blocking your breath. In the prone position, gravity pulls these tissues forward and away from the throat. This naturally keeps the breathing tube open, significantly reducing snoring and obstructive sleep apnea events. Another advantage is a large portion of your lung tissue is located in your back. When you lie face down, you remove the heavy pressure of your heart and stomach organs from these dorsal lung segments. This allows the back of your lungs to expand more fully and receive more blood flow. This process ensures that oxygen is distributed more efficiently throughout the entire body. These effects arise from how gravity acts in the prone position. The anterior torso contacts the sleeping surface, increasing pressure on the thoracic and abdominal cavities and altering diaphragmatic movement. While this changes lung expansion patterns and introduces cervical rotation, the nervous system adapts around these mechanical constraints, balancing airway stability with increased musculoskeletal load. Lateral position. Side sleeping shifts the body's weight from the back onto one side, changing how gravity affects the heart, lungs, and abdominal organs. Instead of being pressed backward, organs move sideways, which reduces pressure on major blood vessels and helps blood return to the heart more efficiently during sleep. Sleeping on the left side creates specific internal benefits. Gravity supports smoother blood flow and reduces pressure on large veins near the heart. The position also changes how the stomach sits, lowering the chance of acid reflux by keeping stomach acid below the esophagus. In addition, lymph drainage, the system that removes waste and excess fluid from tissues, may work more efficiently on the left side due to natural anatomical layout. Sleeping on the right side shifts more weight toward the liver and right lung. This reduces direct pressure on the heart and slightly alters breathing patterns. The liver adapts by adjusting blood flow and bile movement during rest. Across all side sleeping positions, breathing becomes more efficient. The upper lung fills with air more easily, while the lower lung receives more blood, improving oxygen exchange. Side sleeping also reduces pressure on central brain structures and supports the brain's waste-clearing process during deep sleep. Incline position. In the inclined or semi-recumbent position, the upper body is elevated relative to the lower body, altering the direction and magnitude of gravitational forces acting on internal structures. This elevation shifts abdominal organs downward, reducing upward pressure against the diaphragm and allowing more efficient diaphragmatic excursion during sleep. Thoracic compression is reduced compared to flat positions, which can stabilize breathing mechanics. Venous return dynamics change in this orientation. Blood flow from the upper body is assisted by gravity, while lower body venous return relies more on vascular tone and autonomic regulation. This redistribution influences cardiovascular workload and alters nighttime fluid balance. Airway geometry benefits from gravity-assisted soft tissue displacement as the tongue and pharyngeal tissues are less likely to collapse posteriorly. Neurologically, the semi-recumbent position reduces intracranial pressure fluctuations and modifies autonomic signaling associated with breathing and circulation. Fetal position. The fetal position is a lateral sleeping orientation combined with flexion of the spine, hips, and knees. This posture shifts the body into a compact configuration, reducing the surface area exposed to gravity and altering internal load distribution. Spinal flexion increases posterior curvature, which can reduce compressive pressure on certain intervertebral discs while increasing load on others, depending on the degree of flexion. Organ placement becomes more centralized within the abdominal cavity. Flexion decreases abdominal wall tension, subtly changing diaphragmatic movement and breathing mechanics. Lung expansion remains gravity-dependent as in side sleeping, but thoracic flexion slightly limits ribcage expansion, influencing ventilation depth rather than airflow stability. Proprioceptive input is dampened due to reduced limb extension, supporting stable sleep states. Log position. The log position is a lateral, sleeping posture characterized by an extended spine and minimal limb flexion. The body remains aligned in a straight configuration from head to pelvis, maintaining consistent lateral orientation relative to gravity. This alignment produces uniform load distribution across the shoulder, rib cage, and hip on the contact side, reducing localized joint angulation and connective tissue strain. Because spinal curvature remains close to neutral, neuromuscular stabilization demands are low. This allows sustained inhibition of postural muscles and supports prolonged parasympathetic dominance during sleep. Lung mechanics follow gravity-dependent patterns seen in the side sleeping, with stable airflow in the upper lung and effective perfusion in the lower lung, supporting efficient gas exchange. Neural pathways experience minimal torsional stress due to reduced spinal rotation and limb asymmetry. Yearner position. The Yearner position is a side sleeping posture where one or both arms are placed forward. The body remains on its side while the arm placement gently rotates the upper chest and shoulders. This changes how weight is distributed across the shoulder blade, upper ribs, and chest without altering the main side sleeping orientation. This position offers several advantages. The slight chest rotation allows different lung regions to expand during breathing, improving air distribution instead of using the same areas all night. Forward arm placement also spreads pressure away from a single shoulder, reducing continuous compression. The arms provide a constant and stable form of sensory stimulation, to which the brain gradually adapts. This reduces the brain's responsiveness to small external changes. As a result, the arousal threshold increases, meaning that a stronger stimulus is required to wake the brain during sleep. Consequently, minor disturbances, such as light pressure or small movements, are less likely to cause awakenings, helping sleep remain continuous and stable. Over time, this combination supports balanced breathing, better pressure distribution, and fewer unnecessary sleep interruptions while maintaining the core benefits of side sleeping. Starfish position. The starfish position is a back sleeping posture characterized by lying flat on the back with the arms and legs comfortably extended away from the body, allowing for a sense of openness and balance. This open position allows body weight to be distributed across a wider surface, reducing pressure on common stress points such as the shoulders, hips, and lower back. With less concentrated pressure, the body is less likely to shift positions during the night, supporting more consistent sleep. Proper spinal alignment is important because it reduces strain on the muscles and joints while allowing the spine to maintain its natural shape, and the starfish position supports that alignment by keeping the spine straight and centered. In addition, the sense of openness and stability provided by the starfish position encourages the nervous system to remain in a relaxed state, which supports deeper sleep stages and the body's natural recovery processes. Overall, the starfish position combines the stability of back sleeping with enhanced comfort, helping promote calm, uninterrupted rest throughout the night. Let us know in the comments if you are already sleeping in the right position.